In the 1980s, Uganda received its first HIV/AIDS patients, but no one knew at the moment that it was HIV/AIDS killing people. It is said that the disease started from the greater Masaka region. Many people at that time thought it was witchcraft. AIDS-related deaths were reported to be over 75,000 in the late 1980s and early 1990s, with many of them not knowing what really was killing them. There was a rush to get a cure and treatment, so many herbalists came on board with different kinds of medicines and herbal solutions at the time. These came to be termed as budomora, literally translating to small jerrycans, the vessel they used to carry the liquid solution. Notable among the herbalists was a woman mainly known as Nanyonga, who sparked off a craze for eating soil after she claimed it could cure HIV/AIDS. Another known herbalist at that time is the late Haj Rashid Lukwago, who has gone on to create a legacy which has been carried on by his children, who are still pursuing the family business of making HIV medication. Hajat Dr. Aisha Lukwago says their father discovered local herbs that could boost CD4 cell count, which helped HIV patients. To this date, they are still using the same formula.
We used to give people this herb. It was in liquid form. It used to help them in boosting their CD4 count, immune system. But I want to tell you that we don't have cure for HIV, but what it does, it boosts the CD4 count.
According to the executive director of the Joint Clinical Research Center, Dr. Sisi Chitiomuturuza, Uganda did not have a scientific approach towards fighting HIV until 1992.
In 1992, we conducted the first clinical research study evaluating one of the first drug that was invented for HIV treatment. This drug was developed in 1987, and it was being used extensively in the USA and Europe, but it wasn't available here. So in 1992, we did a study to evaluate the lowest effective dose of this drug. It was being given in very high doses in US and Europe, and it also caused several side effects to the HIV patients. So after we determined that we could actually give it at a third of the dose that they were using at the time, we started a program for the patients who participated into the study. They were given access to the AZT, but it was being used as a single drug.
As the time went on, antiretroviral drugs, ARVs, started surfacing on the market. These were mainly coming in from the United States and Europe, but only a few people in Uganda could afford them.
Before that, patients traveled abroad to get these drugs, and that added to the cost. So we brought them closer to people so that they could access them, those who had the finances to do that. And also progressively, instead of taking one drug for HIV, it was found that it was more effective to take 3 drugs combined together. At the time, patients were taking, first of all, the drugs were very expensive. Patients were taking many drugs a day, many tablets a day, and they were also taking maybe 3 times in a day. Some of these drugs also had very bad side effects, but at least they worked on the HIV virus.
JCRC then started to stock some of them into their pharmacies.
So many employers found it more cost-effective to treat their employees instead of losing them. So we started clinics in the western part of the country and eastern part, so that people did not travel all the way to Kampala, to the JCRC, to access these drugs. And while we were doing this, we set up best practices, we set up a network model of providing treatment for HIV. And because we were already experienced, we became a case study for PEPFAR to determine that provision of antiretroviral drugs in developing countries was able to work. And so PEPFAR was announced in 2003.
In the early 2000s, the Joint Clinical Research Center started negotiating with companies that produced generic drugs for people who could not import HIV drugs into the country. This was at 10% the cost of what was available from Europe and USA.
also the Global Fund was set up to support HIV treatment so that patients could access these drugs for free. So we got the first PEPFAR grant in the world, and we started scaling up HIV treatment in different clinics in the country. We trained Ministry of Health, healthcare workers, but also other implementers have now come on board and provision of HIV treatment.
The research to ease the treatment went on from taking so many pills, which many patients failed and lost their lives, to one single tablet a day.
We continue to do research to see which were the best drugs that we could use, what was the level of resistance in the country, and this data has contributed to the improvement of HIV treatment over the years. So instead of having so many pills, now we have combined tablets, 3 drugs combined in a tablet, and now that tablet is being given once a day.
Dr. Mutuluza says that although it's now a single pill a day with minimal side effects, there are still other issues evolving around HIV that continue to affect patients. This includes stigmatization.
There is also stigma. Some people have not disclosed, and when they go to take a tablet, they have to find a place to hide, and sometimes they skip. We have adolescents, they are getting into relationships, they don't want to disclose. So there is still issues with adherence.
As the country looks forward to curb the spread of HIV by 2030, JCRC is looking forward to improving the treatment.
The further simplification we are looking at now is giving an injection given every 2 months instead of taking a pill every day. The research that has already been done in the developed world, where they have found that this injection is equivalent, is not inferior. It acts in the same way as a tablet. But the studies done in Europe and US were in Caucasians, and we are blacks. Participants were mainly male, and here we have more female patients with the HIV. There is a lot of more background resistance to the drugs we were taking previously, and this may affect the response to these new injectable drugs.
As Uganda joins the rest of the world to celebrate World AIDS Day, many of the affected still hope that this year's theme, which says "End Inequalities," gives them hope with the rising number of new HIV infections. Many have also been urged to stay safe, get checked, take their pills for a better Uganda. Story by Fatuma Nachuala for CTV PM Audition.